Hi there, everybody. Thank you so much for joining me. I am here 2 days in a row, which I don't normally do, but thank you so much for being here. I'm excited to talk to my guest, Dr. Sandy Weitz, who I will introduce in just a moment. So, I'm Wendy Margolin, and I help clinicians grow your practice with content marketing. And I'm super excited to have with me a guest who has a ton of experience growing her practice using everything that it takes, including marketing, to do so. So we're going to hear firsthand from Dr. Sandy Weitz, and she is a fellowship trained, board certified pain management specialist who started her own practice and grew it to 11 providers. She built a 25,000 square foot medical office building to house her clinic and multi specialty ambulatory surgery center. You can imagine how much she had to figure out in order to do that. Dr. Weitz also owned an anesthesia company, imaging center, as well as several other vertically integrated medical businesses. Now, Dr. Weitz is teaching other physicians the business of medicine, giving them the tools to maximize their earning potential. So I am super excited to welcome her, and here we go. Hi, Sandy. How are you?
Hi, Wendy. Thank you so much for having me.
Yeah, thank you for being on. I'm excited to hear from a pro who knows the inside scoop on what it takes to build what you did. And then you've also, I know, really just take it on as this second career of breaking it down for other people. So tell us a little bit about what you did then and what you're doing now.
So, I started out after fellowship doing academic medicine and worked at UCSF for 5 years and basically realized that being an employed physician, especially in academics, that there was really very little opportunity. And so picked up and moved cross country from San Francisco to Louisiana and joined an anesthesia group who thought that they wanted a pain specialist. Very long story short, they actually had no idea what that was. They thought I was going to do procedures in the back of a recovery room instead of actually running a multidisciplinary, multimodality pain center. And so ultimately, I decided, okay, I'm going to go into private practice by myself. And so this was a very interesting experience because I'm originally from New York. I went to school in Boston. I did my residency fellowship and stayed on faculty in San Francisco, and then ultimately moved to Baton Rouge, okay, where all of the good old boys live. And so imagine trying to start a private practice from scratch in a place where you don't know anybody, you didn't go to school there, you're not from there, and you need to somehow get people to send you patients, right? And so ultimately grew this practice, realized, okay, I'm out of, capacity. I need to bring on some additional physicians. Brought on my first physician and a mid-level provider. Built this 25,000 square foot building. Initially thought that we were actually going to use only the first floor of it for clinic and the ambulatory surgery center. Within 4 months of moving in, realized that we were out of capacity in terms of space, built out the upstairs to a 23 exam room clinic, and built out the downstairs to a multi-specialty ambulatory surgery center, brought in other specialties to do cases, and then basically it exploded from there. And ultimately brought on a total of 11 providers for the pain clinic, including, those were just docs, and then other ancillary services that we added when I was talking about vertically integrated revenue streams, things like massage, psychology, chiropractic services, other specialties that came in as well. So, basically it was, how do I build out this integrative practice that takes the best care of my patients, where I control the patient experience, and that I also at the same time am able to control the way I practice medicine while maximizing my revenue stream. Uh, Fast forward from when I moved to Baton Rouge in 1998 until we basically sold all of these businesses in 2015 and stopped working at those businesses in 2016. And since then have gone on to realize that physicians are overwhelmed with practicing medicine and less oriented towards the business of medicine and the business of how do you actually get patients to come and see you. And, understand that some of your audience is not physicians, right? But as I already said, we also had physical therapy, we had psychologists, we had social workers. And so you need to have referrals to those people as well. And so in the end, the how do you do it is essentially the same, because you basically need to convince people that you are an expert in your field, that you are likable. And they used to talk about the 3 A's: availability, affability, and ability. And those are the three keys to actually trying to grow any kind of practice. And in honesty, it's really the key to growing any kind of business.
Yeah, absolutely. Yeah, you're speaking my language because that is why I haven't niched down to choose just therapists or just physicians. And because I really like everybody, and the business, the marketing side of trying to get your audience local or, anywhere. If you're doing telehealth, it's really the same of showing them your expertise, that you are the right person to solve their problem based on your experience, but also, like you're saying, your personality, and just being a person. Unless you're a high level specialist in a specific area, and people pretty much have no choice, or are banging down the door to get to you, most of the time that bedside manner, that personality, and that you bring, that spark, is really part of what draws people to you. So definitely, I see the same thing, that it's very similar for all of these different kinds of private practice.
Oh, absolutely. And even, I think that people really don't understand that healthcare is a customer service business. And, I'm in a number of Facebook groups where people take tremendous offense to the concept that a patient is a customer. Doesn't matter whether the patient is going to a speech therapist, a physical therapist, a physician, they are your customer. And you have to have excellent customer service, right? And that customer service, I have to tell you, extends way beyond just that actual provider, right?
Hmm.
So it's your front office, it's the person who answers your phone, it's your website, it's everything and anything about you. It really conveys that customer service component to that potential client.
Right. It's all part of the marketing. I've said that from every job I've worked in. You could be at the best company, but if the person answering the phone hates their job and answers like they're miserable and don't want to help you, that that's your front door. So it's
Oh,
all part of your overall image.
well, and to that end, and this is probably a little off topic from what you want to talk about, but it's part of the reason that is absolutely essential that you provide your front desk with a script. All right. You need to have consistent messaging. All right. If you say something on your website or you have a social media post that you're offering X, Y, and Z, and I call your office and say, hey, I'm calling about X, Y, and Z, and the person at the front desk goes, what's that? Okay, not it. So you actually need to train your staff to be consistent with your message.
Right, right. Agreed. Yeah, all hands on deck. Everybody's consistent. Totally. Yeah. So one of the things you mentioned was talking about like physician burnout, and right now there is an ending physician burnout summit with people from all over the world, thousands of physicians joining. And something that I shared on LinkedIn, and I've just thought a lot about this and recently did a blog for one of my private practice clients, is that it seems like, of the many, many issues, that one piece of the puzzle might be that private practice is a place where the more that we support private practice physicians and clinicians in general, the better off everyone is. Like, the private practice can determine its own hours, the way it works, how much time you spend with a patient or client, who you work with, how big you get, how nimble you can be in a worldwide pandemic, and versus having to, the practices that are bought up by a hospital. And I'm not against big healthcare systems, because those have a place as well, but having that choice for private practice versus like a hospital network practice seems to me like one of the ways to really improve the healthcare system for the clinicians, but also for the patient. So I am not an authority at all. I'm a bystander who, gets a glimpse of the inside because I write content for clinicians. And so I'm wondering if that is something that you would agree with, if it's totally off, or what's your take on that?
No, I think actually that's right on. I think the only way that medicine is going to survive long term is with the resurgence of private practices. Because in that case, you are putting the physician who actually has the education and the, you know, will to do this back in control. The problem, however, is that many physicians have abdicated their role of actually wanting to manage the practice, which is why you have so many employed physicians. Okay. So if you don't understand the business of medicine, if you don't want to understand the business of medicine, then it's very hard to run a private practice or be in a private practice. I think that the overwhelming advantage to private practice, as you said, however, is that in private practice, you choose how many hours you work, what hours you work, you choose what patients you see, you choose what insurance you want to take, and you basically get to practice medicine the way that you see fit and have control over it. Whereas when you're an employed physician, yes, somebody does all the administrative work, but you in turn have abdicated that control to somebody else. And
Right.
the thing that I would tell you, for all of the folks that you have who are listening going, well, I didn't learn that in medical school, or I didn't learn that in PT school, or I didn't learn that in whatever school. Okay. The bottom line is, regardless of whether you're a physician, a, you know, advanced practice nurse practitioner, a PA, a physical therapist, speech therapist, doesn't matter. Okay. What you learn are the basics. And then you have on the job training. All right. I'll give you the example of my husband, who's a urologist, right, who finished his residency in 1994. There was no such thing as laparoscopic nephrectomies. There was really no such thing as robotics, right? And yet today, you have all of these 50 some odd year old urologists who are doing robotic prostatectomies. They didn't learn it in their residencies. Okay, so how is it they're capable of doing it? Well, because they learned it, right? As medicine has evolved, they've learned that new skill. We all continue to learn new skills. So why is it that you think that you cannot learn the business of medicine? Include everything from how to run a practice to how to market a practice. These are all skills that if you are motivated, you can develop.
Right. Again, you're speaking my language. I literally just told someone yesterday in my everyday marketing for healthcare Facebook group, and she said, "You sure make this easy or sound easy." And I was saying, "Well, you went to med school or you went to grad school. Like, you can learn social media, so I think people get intimidated by the tech. And also just by the limitations on everyone's time, there's so many things that go into starting a business, running a practice, and then actually doing the work of supporting patients and clients. And then you've got your whole side life that's not even on the side. It's like maybe your whole world is your family, your kids, like whatever. We all have so many things going on, and we're in a pandemic as we record this. So it's hard to learn new skills. So I hear it that it's overwhelming, but I also agree with you that this is something that everyone can learn, especially someone who powered their way through these really difficult degrees and residency and all that it takes in order to get in that position in the first place.
But I have to tell you, Wendy, I think that part of the issue or part of the solution is, excuse me, if you look at this in its entirety, then you say, oh my God, this is so overwhelming. I can't do it. One of my favorite expressions is, how do you eat, or questions is, how do you eat an elephant? And the answer is one bite at a time. If you look at any of the, how do you start a practice? How do you run a practice? How do you grow this? You need to break it down into digestible pieces. You don't have to do it all in one day. All right. You tackle one problem or one component at a time, and you set up a process for each and every step. And to the extent that you have a process and you can automate that process, right, it will make the next step that much easier.
Right, absolutely. It's like anything in life. Like you and I are both moms, and when someone hands you your newborn, if you like thought that right then you had to know how to raise an 18-year-old, you'd probably freak out. But instead, you just figure out how to feed the kid, how to change the kid, how to make them stop crying. It's like one thing at a time. And then you've got a system by the time the next one comes along. And if they don't, you know, do something totally
Absolutely.
wacky that throws things off balance, like you do it one step at a time. So really, I can't agree with you enough. Like it's the days feel really long, like you're in it forever, but the years are short. It's the same thing with parenting. It's the same thing with running a business or practice. You figure it out in the school of hard knocks and by going to experts like you who can say, I did this, here's what worked.
And, so I know you want to talk about marketing. I have to tell you that marketing is probably one of the easiest components of actually running and growing a practice. And it's probably the thing that is most uncomfortable for practitioners. And it's that tug of war, I think, that makes it so difficult. Why do I tell you that? Well, because especially for physicians, we really are trained not to sell, or we think we're trained not to sell, right? And so it feels uncomfortable when somebody says to you, oh, you have to market yourself, right? I mean, if you think back 20 years, it was like unheard of to have a TV commercial or a radio commercial, right? But the reality is that as healthcare providers, we sell ourselves every single day. And, your listeners are probably thinking to yourself, this woman is absolutely nuts. But I'm
No,
not.
I don't know about that because I do talk about this, but I'm interested to hear your perspective.
If I explain to you why it is you need to take this drug and you push back, all right, and I explain to you the risks and the benefits and why the compelling reasons are for you to do this, or I tell you you need to have this surgery and these are the reasons you need to do this, and you agree, I essentially just sold you on that. Okay.
Absolutely.
We never call it selling. If you told a physician that you just sold them on having to have that patient to have their gallbladder removed, all right, they would look at you and go, what the heck are you talking about? But that is exactly what that is. Okay. So if you can wrap your mind around that, then you can understand that when you are communicating with a referral source, when you are communicating with patients either through, TV, your website, radio, social media, regardless of what it is, You are simply giving them information that makes them want to do X. That's no different than having them sit in front of you and have you tell them, you need such and such procedure. So it's not like I'm asking you to do something that is really against your fundamental principles. And
Right.
if you view marketing as giving people content, information, right, that either makes them understand their healthcare issues or that makes you seem like a real person so they think, gee, I like that person, I want to go talk to them, all right, or give them information that makes you feel seem available, all right, you're not really selling them on anything. And ultimately, they're getting that information from you because they want that information. If they didn't want that information, they'd stop looking at it or stop listening to it.
Right, right, absolutely. So you're recognizing that you understand their problem and letting them know that you have a solution and how you can provide it. And you do that in the office all the time. And that's what we do in our marketing. So, what would you say are like some first steps in marketing a practice when you're new?
Understand, well, there are a couple of things. Number one, understand the demographics. Okay. Um, for example, I hear from a lot of people who go, oh, I don't want to take insurance. Okay, well, if you live in a place where 80% of the people have either employer insurance or have Medicare, and you say that you're going to charge, you're only taking cash, that's an issue. Okay. You need to figure out how are you going to communicate what makes you so different that they should pay you only cash and not take insurance. You need to define your niche. Okay. You have to define what makes you special, interesting. It may be that you speak a foreign language. It may be that you are, very empathetic, whatever it is, but you need to be able to really think through what do you want to communicate to somebody are your strengths, the things that make you different. Okay. Particularly, as you said, Wendy, if you are a super sub specialist in a place where there are none of you, then people are going to come to you because like you're the only one. But if you are somebody who is doing something where there are multiple of you, you have to figure out how are you going to position yourself to differentiate yourself. Okay. You need to decide or understand where are people, clients going to come from. Right. And the couple of points there. Number one, I personally believe that it's easier to get referrals from other providers than it is to go and get them individually. Okay. Because if you hit on one referral source who can send you 10 clients versus trying to get 10 individual clients, that's going to take you much more work. Okay. That said, you need to think outside the box. Right. My practice had 1,000 different types or 1,000 different people who referred to us, not clients, not patients, but people who referred to us. So I was a pain specialist, right? So everybody's going to sit there and think, oh, well, that's obvious. It's the orthopods and the neurosurgeons. Yes, but no. Okay. It's the internists, it's the GYNs, it's the PTs, it's the massage therapist, it's the chiropractors, it's the neurologists, it's anybody who sees any type of patient with a painful condition who would benefit from being seen by a pain specialist. So you
Which
need
is
to,
everybody.
which is basically everybody. It's every type of provider that you can imagine.
Mhm.
So if you limit your, scope to only a handful of referrals, then what happens when Dr. Smith goes on vacation? All of a sudden your referrals dry up, right? Or, again, this is probably heresy, but doctors are fickle. And if you live in the South, they're really fickle. If you play golf with them, they like you today. Some other guy comes along who went to LSU, they like that other guy better. So just because they're referring to you doesn't, or maybe your front office staff didn't answer the phone fast enough and a patient came back and complained about it, and they say, oh, well, I'm no longer referring to that office because their front office staff is crappy, right? Bottom line is you need to cast a wide enough net to try and get referrals from a whole scope of people. And
Yeah.
you do that by basically interacting with them. Understand in this case, you actually have two clients. You have the patient itself, but you also have that referral source. And so doing things like, aside from, social media posts, website, go give a talk to that ENT group, or go give, if you're a speech therapist, go give a talk to the ENT group. If you're a psychologist or a social worker, okay, go talk to a group of family medicine doctors, right? These patients are coming to these doctors. They're telling them that they're depressed, okay? And physicians, one of the issues I think that people miss out on in terms of a marketing opportunity is not only does the patient want the problem solved, the doctor wants the problem solved, okay? So if I'm a PCP and I have limited time and I am seeing a patient who is overwhelmed because they're stressed or they're depressed or they're whatever, if I have an excellent therapist to refer to, okay, and I can give you the name, I've solved your problem, right? Because I'm being empathetic and I'm listening and I'm telling you, hey, we can solve this, by going to see so-and-so. But I've also solved my own problem because I don't have to sit in the room another 20 minutes trying to deal with the stress and depression, right? So if you can go communicate how you're going to solve somebody's problem and understand that you're solving multiple people's problems, both the patient as well as the referral source, I promise you it will pay you dividends.
Mm-hmm. That's great advice. So going in person, or now it might mean even Zoom, because but offering your expertise and not just right away saying, hey, do you have any people you can send my way?
A
But
matter of
saying,
fact,
how
you
can I
should
help
never
you?
say that.
How can I talk to you about something that you're seeing a lot in your practice? These are some things that I've talked about in the past, and having that like script ready. That's great advice.
Yeah, I mean, I have to tell you that if you show up and say, "Can you send me patients?" the other person's gonna shut down. Okay, they want to know, how are you going to help them solve their problem. And then the other thing that is sort of an aside to this, and it depends on the community you're in, you want to do that in such a way that you communicate you're not going to hijack that patient. Because
Right.
a lot of times physicians and other providers, doesn't matter who it is, are concerned if I refer that patient out, that patient will no longer be my patient. And since every healthcare provider, regardless of specialty, right, wants to be able to retain their patients, the last thing they want to feel is that if I refer to this physical therapist, or I refer to a speech therapist, or I refer to another physician, that patient is no longer going to come back and see me. Okay. And then the other thing that I would tell you, and I think people don't think about this, but this is like a huge no-no, is if I send a patient to you, okay, I'm a pain specialist. Let's say I send this patient to a physical therapist, or I send a patient to a psychologist, right, who's not part of my practice. If that physical therapist in turn sends that patient to a neurosurgeon instead of back to me, okay, I'm probably not sending to that physical therapist again.
Mm-hmm.
Right?
Yeah.
You need to be super aware of all of those patterns.
Mm-hmm. Yeah, that's great advice. So you've given so much advice, and I know you also have a podcast, right?
Yes, ma'am.
and you're active on social media. So tell everyone where they can find you and learn more from you about not just how to market a private practice, but how to actually build one.
So my website is thepracticebuildingmd.com. And I have a podcast and a Facebook group, the Private Medical Practice Academy. And you can find me in any of those places.
Okay, awesome. And if you're watching on LinkedIn, I'll put that in the comments when we get off. And if you're listening on the podcast, I will put that in the show notes. So thank you so much for being here. I really appreciate talking to you and learning from you, and also just catching you in between locations. Every time I've talked to Sandy, she's somewhere new, and it's always exciting to find out where you are and where you're going.
Thank you so much for having me, Wendy. This
Okay,
has been
see you
great.
all next time.